If you are a first-time dad-to-be, then you obviously don't know what to expect from the day of your delivery. When should I take my partner to the hospital? What if I take her there too early or too late? What is expected from me during her labor, etc. Right? And so in this video, I want to help you form the right expectations about the delivery of your child. And most importantly, I want to show you how you can support that process. I am Mathias, a researcher in Science Geek and dad, and normally I'm here with my partner Nathalie, who is a pregnancy and birth consultant and TCM therapist. But this is supposed to be a video from a guy for guys, so I told you to stay away, right? And now let's get started. Let's be honest here, most first-time dads-to-be are scared of the day when everything is gonna happen, although we would never admit it, of course, right? First of all, you don't really know when those contractions are gonna start, right? And second, most dads-to-be also fear that they won't make it to the hospital in time and that baby is born in the car. Now, let me give you some reassurance straight away. Normally, I said normally, okay? So normally there is plenty of time between that moment when contractions start and the moment when that baby is being born. Plenty of time. I know you have probably seen all those movies when a woman's water breaks and then everybody screams hysterically, oh my God, the baby's coming. So basically in 1 minute, right? And then you can already see her pushing. But this is complete and has absolutely nothing to do with the reality. You see, the birth of a baby consists of several stages. First, the gate down there needs to open, okay? And by gate, I mean what is called a cervix that needs to dilate, as we say, to 10 centimeters. So basically wide enough for the baby to fit through it. Right? And only once that gate is fully open, the actual delivery of the baby can begin, which means that the woman pushes that baby out of there basically, right? So again, dilation phase first and then the pushing phase. The crucial thing to know here though is that normally, again, I said normally, okay? Normally the dilation phase takes quite some time, particularly if the woman has never given birth to a baby before. On average, it takes about 10 to 15 hours for first-time moms to dilate from 0 to 10 centimeters, although it depends a bit on the study you're looking at. And yes, there are exceptions. In some cases, it can take considerably longer than that, for example, when baby is not in a good position for labor. And sometimes women also deliver a baby in less than 4 to 5 hours, including the dilation phase. But rest assured, those cases are very rare. Again, normally there is plenty of time to take your partner to the hospital. Right? Now, what's also important is that you don't take your partner to the hospital straight away as soon as contractions start. I know that many guys would probably feel better if they could do that, including myself probably, right? But the problem is, if you take your partner too early to the hospital, in most cases they're gonna send you home. Why is that? Well, they want your partner to spend the early stages of that dilation phase we talked about at home. And there are several reasons for that, but basically at home, women tend to be more relaxed because, it's an environment where they feel safe, right? And so labor tends to progress more easily. While at the hospital, it's a new environment, maybe there are things that bother her, and so labor may not progress as smoothly as when she's at home. Now, if that happens at home, they basically don't care, right? But if your labor progresses very slowly at the hospital, they may be tempted to try medical interventions to speed things up. And that, is a very controversial topic because such interventions could lead to complications which may require further medical interventions, right? And because of that, they are normally not going to admit her if she's not dilated to a certain degree. By how much depends on the hospital policy, right? But basically, if it happens, they're gonna send you home. And trust me, this is when your stress levels will go through the roof, okay? So how can you avoid that this happens? Well, timing is important, and by timing I mean the time gap between your partner's contractions. So normally your midwife will tell you to come to the hospital if her contractions come in intervals of 4 to 5 minutes, if each contraction lasts for at least 1 minute, and if they have been doing that for at least 1 hour. This is normally the moment when you would take your partner to the hospital, but it depends on the hospital policy. So please ask your partner's midwife what is their hospital policy and when you should take your partner to the hospital. And just a quick word in case days your partner needs to be induced. Obviously, if your partner is going to be induced, you're going to take her to the hospital at a time when her contractions have not yet started. And many dads to be, they like that thought, right? But the downside of inductions is that it can take several days because oftentimes the first method of induction does not work straight away. They often have to try several things to get those contractions going, right? So be prepared that you may have to stay at the hospital for several days. Many people will tell you that nothing that you do as a birth partner will help your partner dilate faster or help your baby descend in your partner's pelvis more easily. Frankly, my partner Nathalie and I couldn't agree less. Your support and anything that you do for your partner during labor is vital and can significantly speed up the process. And I'm going to explain in just a second why that is and what you need to do. But basically, if you want to support your partner during labor, then there is only one goal you have to focus on, and that is supporting your partner in a way that allows your baby to move through your partner's pelvis and then later birth canal more easily. And keep in mind, this can also help her dilate faster because the deeper your baby descends in your partner's pelvis, the more pressure there will be from your baby's head on your partner's cervix. And that pressure will help dilate the cervix. So the question is, how can you support your partner so that baby is able to descend in your partner's pelvis more easily? Well, there are three main factors that determine how smooth that descent is going to be. Your baby's position, your partner's labor and birth position, and your partner's posture. Keep in mind, of course, there are also other factors like, the shape of your partner's pelvis, or maybe your baby is like super big, right? But let's just focus on the standard case here because we cannot cover all exceptions here, right? Anyway, so the most important one of those three factors is baby's position or the position of baby's head, right? And it's easy to see why. For example, let's say your baby's head is trying to enter the mother's pelvis, a process that we call engagement, by the way. Well, in this position that you can see here, it's gonna be difficult, if not impossible, because the top of the pelvis has an oval shape that extends horizontally. Baby's head has an oval shape too, if you look at it from this angle, but in this position, it's gonna be more difficult to enter the pelvis, right? And so ideally, baby's head enters the pelvis in that position, and then the whole process is gonna go much smoother. And our job is to help the baby with that, right? Keep in mind, this is only just one example of how baby's position has an impact on the whole labor process, right? So the question is, how can you as a birth partner support your baby find a better position? Well, this leads me to the other two factors that I mentioned before, your partner's labor position and her posture. I'd say that the most important way to help a baby find a good position during labor is by adopting good labor and birth positions, which your partner has to do, right? But this is also where you come into play. But let me give you another example first. So let's take the same situation as before. So baby is trying to enter the pelvis again, right? But because baby's mother is not in a good position, let's say she sits on the hospital bed and leans back, the tip of baby's head gets stuck here against the mother's pubic bone. Oh, and by the way, I'm brutally exaggerating right now, okay? Because I'm trying to make a point here. So if you're a midwife or doula, please don't slam me in the comment section for this. Again, I'm just trying to make a point here. Anyways, now listen. If that woman would go into an upright position, for example, this position, several things would happen. First, the center of gravity would change, okay, allowing the baby to change the position. Second, in that position, the baby's body would be better aligned with the mother's pelvis because she basically changed the angle of her pelvis for her baby. And third, now, because the mother is in an upright position, gravity will pull the baby downwards. So she basically added an additional force next to her contractions that supports the baby descent in her pelvis. And so with a simple change of labor position, you do not only make it easier for your baby to move through the mother's pelvis, you also increase the pressure on the cervix, which helps dilate it. And obviously both can help you speed up the labor process. Now, where does this leave you? Well, many of the labor and birth positions that a woman is going to adopt during her labor require your support. And please don't underestimate this. For example, the position that we had earlier may allow your partner to be just in the right angle to help your baby move further down in the pelvis. And she could even support that process, for example, by gently rotating her hips, because when she does that, she offers your baby different angles into her pelvis, and that might just do the trick to help your baby move further down in the pelvis. So this can be a great position for the dilation phase, but it does require your support. Now, of course, not every position requires your support, right? For example, maybe your partner just wants to lean over a birth ball. That's great. In that case, you can focus on other things that we're going to talk about in just a second. But some positions do require support. Here's another one. It is a position that a woman would often adopt in the final stages of her delivery when she wants to support her baby move the head around her pubis symphysis. This position is only possible with your support, well, unless the labor ward is equipped with certain tools, but oftentimes it isn't. Now, the question is, of course, what is the right position during labor? Well, as your baby moves deeper into your partner's pelvis, baby faces lots of different kinds of challenges. And because of that, there is no such thing as the best labor position. Instead, it's important that your partner keeps changing her position based on what's happening inside her womb. And of course, there are a ton of different labor and birth positions that your partner could adopt, both for the dilation phase and the pushing phase. But this goes beyond the scope of this video. However, we do discuss this in detail in our birth preparation courses. You can find them in the description below this video. But the best advice I can give you is to listen to your partner. Moms-to-be often instinctively adopt the right labor position when they listen to their body. For example, when they adopt a position in which they feel less pain, it is often a position in which the baby can indeed move through the pelvis more easily, because maybe in the previous position, baby's head got stuck somewhere and was not able to move further down, which may have caused the mother pain. And by adopting a less painful position, the mother may have removed that hurdle for the baby. Right? Now, talking about pain, this actually leads me to the third factor that I mentioned earlier, and that is the posture of your partner. The posture of a mother-to-be during her labor has a lot to do with pain. And similar to a mother's labor position, her posture will also have an impact on how easily a baby is able to move through her pelvis. For example, if you look at this woman, she is obviously in a lot of pain. Right? And that pain lets her adopt a posture that, well, let's just say it is likely to make the descent of her baby much more difficult. Or let's take the example of a woman who clenches her teeth during each contraction, right? Well, that just shows you that that woman has a very hard time coping with her pain. And most likely that tension will affect her entire body. Right? When that's the case, it will slow down labor progress. And so your job during her labor is to help her manage that pain. If you can do that, her body will be more relaxed, her posture will reflect that, the baby can move through her pelvis more easily, and her labor is gonna go much smoother. And you can help her manage pain in several ways. First, again, by helping her adopt certain labor and birth positions, because as we now know, this may help with the pain too. Right? Second, by helping her breathe. How can you do that? Well, just imagine what happens when you suddenly feel pain. When severe pain kicks in, it takes away your breath, right? And so the key to help her manage pain is to help her keep breathing, either by breathing with her, you lead, she breathes with you, or by encouraging her to keep her breathing rhythm, most importantly by counting for her. So breathe in, 1, 2, 3, and then breathe out, 1, 2, 3, 4, 5, 6, as an example, right? Or if she completely loses control and is just too overwhelmed by her pain, and by the way, this is something that can often happen during the final stages of the dilation phase, then you have to help her find her way back into her breathing rhythm. However, this is something that requires certain techniques, which we teach in our birth preparation courses, because this is advanced stuff. Right? And then the third way to help her manage pain is by certain comfort measures, for example, by applying certain treatments. And again, there is a lot that you can do. We cover many different comfort measures in our birth preparation courses, right? But in this video, I just want to show you two things. First, I'm going to show you 2 pressure points for pain. So that's basically alternative medicine, right? And then I'm going to show you a sacrum massage. So first of all, we have 2 pressure points that you would press whenever your partner experiences pain, so mostly during her contractions. Okay, so let's have a look how we can find them.
First of all, position one of your hands like I'm doing it here. Then look for the highest point on the muscle. It is located right behind the fold between your thumb and index finger. When you put your thumb of your other hand on that point and then open your thumb and index finger, the point is supposed to be at the center of that little triangle that forms between the bones of your thumb and index finger. Firmly press and massage the acupressure point for about 10 to 30 seconds. Afterwards, do exactly the same on your other hand. Next, you first need to find the highest point of your medial ankle bone on the inside of one of your legs. Then you need the approximate width of your 4 fingers. If your partner helps you, he's supposed to take the width of your 4 fingers. If you do it yourself, simply place your fingers right next to the highest point of the medial ankle bone. Your new point is located right next to the bone at the end of your fingers. From there, simply move a tiny little bit away from the bone until you can feel a fleshy webbing. That soft point is the acupressure point that you want to firmly press and massage for about 10 to 30 seconds. Afterwards, do exactly the same on the other leg.
Okay, so that was pressure points. Keep in mind that you can press and massage them throughout the contractions or however long your partner wants you to, right? Okay, and then we have a sacrum massage. The sacrum is simply here at her lower back. In some women you can see this very well because they have those what is called dimples of Venus. But if you cannot see them, don't worry, just massage the center of her lower back in circular movements. So basically the way we show you here. And while you do that, ask her where she wants you to apply pressure and also how much pressure she likes. Normally they love when you massage their sacrum during labor, particularly when they feel contractions mostly in their back. Right? So this is definitely something you should try. Now, of course, those things are only some ways to support your partner during her labor. Obviously, there is a whole toolbox full of tools, treatments and techniques that you can apply to support your partner during her labor. We teach you those tools in our birth preparation courses that you can find in the description below this video. What you should definitely do is check out our free mini birthing course in which we show you a few very simple breathing techniques that will be a big help during your partner's labor. And it's also great for you to know these techniques in order to be better able to support your partner during her labor. You can find the link in the description below this video. Alright, so that's it for today. I hope you found this video helpful. If you did, I would be super grateful if you could leave me a like below this video. And for more useful tips and tools on pregnancy and baby related topics, make sure to subscribe to our channel and to hit the bell.